Hello and welcome to the Lead. I'm Jake Tapp, where we begin this hour with our health lead and the strongest case yet for getting a COVID booster shot, or should I say strongest cases yet. 3 new CDC reports show that adults who'd gotten their booster shot had the best protection against hospitalization because of COVID and against emergency room and urgent care visits. The new data suggesting getting a booster in the age of the Omicron variant is now less of a nice to have and more of a must have. This, as we are learning that unvaccinated adults over the age of 65 are nearly 50 times more likely to be hospitalized for COVID than their fully boosted peers. Across the U.S. today, more than 160,000 people are hospitalized with COVID right now. That is a record high. But as CNN's Omar Jimenez reports, the number of daily cases are actually trending down, even as some hospitals are growing more crowded by the day.
The reason this January is so dramatically different from last January is because we have the tools we need to protect people.
Being boosted has never been more important.
Protection against infection and hospitalization with the Omicron variant is highest for those who are up to date with their vaccination, meaning those who are boosted when they are eligible.
One CDC study published Friday looked at 88,000 hospitalizations across 10 states in December and January, when Omicron has been dominant, finding being boosted was 90% effective at preventing hospitalization during Omicron, only slightly down from the 94% when Delta was the dominant variant. So, boosting remains the highest protection possible. But for those with just 2 doses, after 6 months, the vaccines were 76% effective against urgent care and emergency department visits, primarily during the Delta surge. During Omicron, that fell to 38%. And for the unvaccinated, new CDC data shows those 65 and older were nearly 50 times more likely to be hospitalized last month than those who were boosted.
These new studies should erase any doubt about the importance of boosters at this point in the pandemic. I think there's been, unfortunately, so much muddled messaging that made it clear that
So far, less than half of those eligible to get boosters have gotten them. Meanwhile, Omicron's rapid spread is still straining hospitals, which are at a record high, and some essential services. Entertainment also taking hits, like curtains closing for Adele's residency in Las Vegas.
We've been absolutely destroyed by delivery delays and COVID.
But with vaccinations on the rise and cases beginning to decline in some places, experts hope the country is finally turning a corner. Former CDC Director Tom Frieden believes Omicron is not to be underestimated, but if you're vaccinated and boosted, it's comparable in severity to the flu.
What we're seeing is that the country is essentially building a stronger and stronger wall of immunity. And that wall comes from mostly vaccination, but also prior infection. But the stunning thing about Omicron is how remarkably infectious it is.
And on that infectiousness, data from Johns Hopkins shows that more than a quarter of all COVID-19 cases reported since the pandemic began were reported in the last month. Separately, Dr. Rochelle Walensky says that if you're eligible to be boosted but haven't been, you're not considered up to date on your vaccinations, and that the CDC is looking to pivot language around what it means to be fully vaccinated.
But they haven't done it yet, not officially. Omar Jimenez, thanks so much. Joining us